Good morning! Mabuhay at magandang umaga sa lahat. Assalamualaikum and Ramadan Mubarak to our Muslim participants. Welcome to our first online discussion series of the Women Rise Above COVID, led by UN Women with support from the government of Japan. I am Marcela Aguilar and I will be moderating today's activity. Today's session will be the presentation of the research findings measuring women's leadership and meaningful participation in COVID-19 response undertaken by the Humanitarian Advisory Group, which we will hear more from later. We would like to acknowledge all our participants today coming from various organizations, sectors, and geographical locations. Special greetings also to those who participated in the research that we are about to present today. We are tremendously happy that you are able to join us despite your busy schedule and perhaps Zoom fatigue. We look forward to hearing from you as you provide your insights, comments, and perhaps questions in the course of our discussion. Just to remind us of just some reminders for our activity, as we earlier mentioned, please indicate your name and organization. You may edit your name by right-clicking your name and then rename. You may also include your gender pronoun, he, she, or they. Please turn off your mic throughout the activity to lessen our Zoom fatigue. And if your bandwidth permits, kindly turn on your videos so we can relate to you during this activity. Otherwise, please make use of your reaction buttons located on the lower portion of your screen. As there will be presenters and reactors later, feel free to provide your comments as well as questions during our activity through using our chat box. We would also be delighted to hear forward-looking strategies or solutions that could be useful in pushing for greater women's leadership in COVID-19 response. Feel free to write in English or in Filipino, and we will be collecting this as much as possible, and as much as possible, raise them in plenary during the open forum. Before the end of the activity, we will also share with you the link of the research, our main discussion for today. And should you be needing a certificate of attendance or participation, kindly contact Anna Vineles of unwomen.org. Her email address will be placed in the chat box later. To formally welcome us, may I now call on Gael Demoli, OICAI of UN Women Philippine Program Office.
Thank you very much, Marcel. Good morning, everyone. It's my pleasure to welcome you today. This is our first Women Rise Above COVID discussion series, which kicks off today with a discussion on measuring women leadership and meaningful participation in COVID-19 responses. It's been now more than a year that our world has been turned upside down. On 11 March 2020, WHO declared the COVID-19 outbreak a global pandemic. So now we are more than 1 year later, and it's time to take stock and understand where we are and learn from our experience. The COVID-19 pandemic has again highlighted the underrepresentation of women in decision-making and leadership position, and led to renewed call for women to be included in decision-making and for the needs of priority diverse groups to be included in the responses. Despite WHO and the international community recognizing the need to include women in decision-making for outbreak preparedness and response, including in Security Council Resolution 2532 concerning COVID-19, women remain inadequately represented in COVID-19 policy spaces. Out of 225 COVID-19 task force across 135 countries, so this is worldwide, women make up only 24% of task force members. But we need to dig deeper and understand not only the percentage of women in COVID-19 task force, but more significantly, to what extent women's rights organization and women's led organization were able to participate, and to what extent their leadership and their participation translated into something concrete in terms of gender responsive policies. What were the end results? Were they able to influence the outcome of the recovery plan, for instance, or the gender-based violence plan, etc.? Today, we will launch and present the UN Women and Humanitarian Advisory Group framework and tools for measuring women leadership and meaningful participation in COVID-19 responses. This tool is very important because it allows each country to do a self-assessment and see to what extent women's rights organization and women's led organization were able and are able to provide meaningful input to national COVID-19 related responses. And today we will also hear from the researchers who have conducted this research in the Philippines, and they will share some key findings of the research. There was tested a way to test this framework and tools. And we will also engage in a conversation that we can collectively discuss and agree on how we can work together to further improve women's leadership and meaningful participation in the country to respond to these continuing gaps that exist. I would like to take the opportunity to thank you all of you who are present today and who contributed to this research. UN Women remains committed more than ever to support women and girls and placing them at the center of our response, whether it is humanitarian action or when it comes to eliminating violence against women, promoting women's economic empowerment, enhancing women's access to justice, or advancing women's peace and security agenda in the Philippines. As you know, today's discussion is the first of a series that we called the Women Rise Above COVID. And there are 4 objectives to this series. The first one is to raise awareness on the gaps and challenges related to COVID-19, response, recovery, and prevention, and as it is experienced by women and girls in the Philippines, whether it is in urban or rural settings. Facilitate access of women and girls to correct and adequate information related to COVID-19 prevention measures. Facilitate possible collaboration and partnership with government, non-government, and CSOs, and also to see to what extent we can address these gaps together. And the last objective of this series is to support policy recommendation to ensure that legislation and policies related to COVID-19 responses are gender responsive. This research and discussion were made possible through the generous support of the government of Japan, so I would like to thank them for their support. My appreciation also goes to the Philippine Commission on Women, the Department of Health, the Department of Information, Communication and Technology, and Development Academy of the Philippines. I would like also to acknowledge the fruitful partnership with our sister agencies, in particular UNICEF, UNFPA, NURO, and FAO, as well as members of international NGOs and CSOs and the Academy, without whom this research would not have been possible. We do hope that you will be able to participate meaningfully and have to this discussion and to the next discussions in the series in the coming weeks. And I look forward to your active engagement on this discussion today. Thank you.
Thank you so much, Gael, and thank you also for the questions that you have started to give to us as probably some guideposts also when we take a look at women's leadership and meaningful participation in COVID-19 response. Now, let me call on today's presenters who developed the research measuring women's leadership and meaningful participation in COVID-19 response. Maya Tamayo is a passionate advocate for women's rights and the arts. Much of her career has revolved around forwarding gender in governance, sexual and reproductive health and rights, and women's political participation through feminist research and program development. She is currently the co-founder and program manager of the Angat Bayi, a women's political empowerment program under the University of the Philippines Center for Women and Gender Studies. Pip Henty, on the other hand, specializes in gender and inclusion and humanitarian practice. Over the past 8 years, Pip has worked in operational and technical roles in the not-for-profit and private sectors, including the areas of international development and humanitarian action. To the participants, as I earlier mentioned, the link of their research will be shared by the end of their presentation. Feel free to provide your insights, comments, and questions using the chat box. Giving the floor now to you both, Maya and Pip.
Thank you so much, Marcel. Good morning, everyone. Good afternoon to others who are on a different time zone. We are very happy to be part of the first of the series of Women Rise Above COVID online discussion. And we thank you for joining us, and we are looking forward to sharing with you the findings of our research on women's leadership in COVID-19 responses in the Philippines. I'll turn you over to Pip right now to start the discussion rolling.
Wonderful. Thanks. Thanks so much, Maya. And again, thank you so much to everyone for attending today and for allowing both Maya and myself to present. If we can just go to the next slide, if possible. And just one after. Yeah, and then the next one. Wonderful. So this report is part of a research project that contributes to UN Women's broader project in Asia and the Pacific that looks at women and girls at the center of COVID-19 prevention. And the purpose of the research was to develop a framework and tools to measure women's leadership and participation in the COVID-19 responses in Asia Pacific. And then the framework and tools were then piloted in the Philippines and adjusted in order to incorporate any learnings. So what is public is both the tools and framework as a standalone document, in addition to the baseline report that we produced in the Philippines. And as previously mentioned, we'll be able to share links to both of those documents in the chat box. Just next slide, thanks. So just as a quick overview, before we launch into the findings, a little bit on the what, how, and who of the framework. So as we've mentioned, the framework was intended to measure women's rights organisations and women-led organisations' leadership during COVID-19. And we're really hoping that these tools can also be adapted to measure leadership amongst other crises and disasters across the region as well. And the tools are aimed to be used at either a sector level, similar to what we have done in the Philippines, or at an organisational level, prompting organisations to reflect on and open discussions around engagement and support to women's rights organisations. So as I've mentioned, the document includes a measurement framework, a self-assessment survey tool, a key informant interview guide, and a research statement that can support other sectors, other countries, other organisations who are looking to implement this research themselves as well. And as mentioned, we're really keen for this to be contextualised by humanitarian actors to measure progress, either in a context or organisational perspective of women's rights leadership in COVID-19. Next slide, thank you. So what is being measured, and we'll go into a little bit more detail around what this means in practice through the Philippines baseline. But the women's leadership and participation in COVID-19 response framework includes three key result domain areas, and that's looking at safe and meaningful participation, collective influencing and advocacy, and partnership capacity and funding. And there's also the overarching impact domain that you can see there, which is transformative leadership. And these domain areas were developed through a consultative process that we went through with actors across the region, including a number of you who are here today, and also build on existing approaches to measuring women's leadership, both within the sector and more broadly, but also measuring localization as well. And the measurement framework is really built on the assumption that when all three result domain areas, so that is safe and meaningful participation, collective influencing and advocacy, and partnership capacity and funding are supported, then diverse women and women's rights organisations can then have a transformative leadership role in COVID-19 responses, and of course other humanitarian responses as well. Just the next slide, thanks. And so before I hand over to Maya to unpack some of the key findings, just a quick snapshot of the research process. So we used a mixed methods approach in order to validate the data that was coming out. We engaged women's rights organisations, NGOs, national NGOs, international NGOs, UN agencies, other civil society bodies, and of course, national and local government. And the research was led, a research data collection was led by Maya, who we have here today, with the support of Ayala, who also was involved in that process as well, and were involved in the design, debrief, and analysis of the data that we are about to present to you as well. I might hand over to Maya to start to unpack the key findings. Of course, we encourage questions, comments, feedback, either in the chat box. We can also leave our email addresses in there if you have any questions that pop up post event as well. But over to you. Thanks, Maya.
Thank you, Pip. So I'd like to start with the safe and meaningful participation domain, one of the domains that Pip has mentioned earlier. This domain seeks to measure the extent to which there is safe and meaningful participation for women and its impact on broader COVID-19 response efforts. Next slide, please. Okay, thank you. So there is moderate evidence that women and women's rights organizations participate actively and safely in decision-making processes and it can influence outcomes. Diverse women and national and local women's rights organizations are engaging with the COVID-19 response, mostly at the local government level. Evidence suggests that these WROs participate in CSO fora and community meetings, but that most are not represented or engaged in national level decision-making and coordination fora. While there were low levels of women's rights organization participation in and representation at humanitarian coordination, these platforms were seen as critical fora for increased women's rights organizations representation over time, particularly the GBV subset cluster and protection. Although the national GBV subcluster was reactivated in December 2020 only, UNFPA as the co-lead has supported the Department of Social Welfare and Development in GBV preparedness and response activities prior to this. The lack of participation at the national level resulted in unmet needs for women. For example, women's multiple burdens increased during the pandemic with little rest from unpaid care work. Furthermore, sexual and reproductive health became harder to access and increase in GBV cases was observed. The necessity of these services had not been adequately considered in the response planning. There was also moderate evidence that coordination and consultation fora addressed access and safety consideration for women's rights organizations. WROs have been able to participate in a wide range of fora during the pandemic through online platforms mostly. However, this also creates additional barriers to diverse women's participation. For example, persons with disabilities might be unable to participate if sign language is unavailable. Rural women may have difficulty participating if there is no or poor internet connection or they're unfamiliar with the platforms. There was also instances when some women's rights organizations are not simply invited to the meetings. In some cases, these organization partners support them by providing transportation, per diem, and communication allowances so they can participate. Next slide, please. It was also noted that the more mainstream and less gender-focused fora women participated in, and the more senior these meetings became, mostly at the national level, the less safe they felt. This was due to, first, the power dynamics that can exist between international and national organizations. Women's rights organizations' reflections showed that international organizations had a majority of power. The second was the perception that the culture in some of these fora led to derogatory remarks being directed at them. Okay, so the next domain that we're going to look at is the collective influencing and advocacy. This domain measures the extent to which women's rights organizations are supported to advocate and engage with processes that influence COVID-19 responses. The evidence that COVID-19 responses are holistically influenced by the priorities of women's rights organizations has been assessed as moderate, because while there have been successful examples of advocacy influencing, these seem to be ad hoc rather than sustained and systematic. There is also moderate evidence that the national and local women's rights organizations and grassroots networks are able to advocate for and engage in the development of policies and standards in relation to COVID-19. Women's rights organizations and networks have been very active in advocacy during COVID-19. 85% of them surveyed stated that it was one of the ways in which they influenced decision-making during the pandemic. There were women's rights organizations who were able to advocate the integration of gender in the response of a government agency. In some LGUs, in some local government units, women's rights organizations are able to advocate because leadership, and these are mostly women mayors who have the gender lens, provides the space for women's rights organizations to advocate for their issues to be integrated in the pandemic response. Meanwhile, international partners and donors have amplified the voices of national organizations and these women's rights organizations. For example, in one context, some women's rights organizations were not recognized as humanitarian agencies, even though they were frontline responders to the pandemic. International partners advocated for them to receive humanitarian passes to allow greater movement to implement programs and respond to the needs. This is also evident through the activation of the GBV subcluster. However, despite the active advocacy and some examples of influence, impact on national policies and standards has been limited. Only 21% of women's rights organizations surveyed and none of the international actors believe that national and local COVID-19 policies and standards reflect the priorities of these women's rights organizations. This gap between the wealth of work and advocacy happening at a grassroots level and the ability to meaningfully influence policies and standards is reflected in the poor opinion of the extent to which gender is addressed in COVID-19 response plans and programs. Back to you, Pip.
Thanks so much, Maya. So the third area we explored was partnership capacity and funding, which you can see on the presentation now. And what we found was that for women's rights organisations to shape COVID-19 responses, they must be supported to prioritise their organisational needs, to strengthen their capacity to deliver programs to those in need, and to access adequate funding and to participate in decision-making over funding changes and reallocations. So overall, there is good evidence of equal and complementary partnerships, targeted and relevant support and funding for women's rights organisations. In particular, there was good to strong evidence of partnerships and capacity support, particularly where partnerships existed prior to COVID-19. And whilst there is good evidence that financial support was adequate, really the research found that this should have been strengthened, this could be strengthened, through increased financial decision-making in women's rights organisations. And before I unpack those three areas, I think it's really important to highlight here that this is where conversations around power dynamics and feminist values were really highlighted. So sometimes unequal power dynamics between women's rights organisations and their donor partners were unequal. And in many ways, many organisations felt COVID-19 exacerbated this inequality. Organisations also felt that those partnerships that came with a feminist approach, including values and a feminist lens, were more effective and efficient, and were able to provide better support than those that didn't. And that was really highlighted through these three areas. So as I've mentioned, there were some good examples of equitable and complementary partnerships between local and national women's rights organisations and other responding actors during COVID-19. So where project partnerships existed prior to COVID-19, women's rights organisations reported increased flexibility and more equal partnership dynamics. And there were also examples of COVID-19 response proposals being co-created, designed and implemented with 73% of women's rights organisations interviewed noting that this was the case. However, despite these positive examples, this was not consistent practice and was not reflected across all partnerships. Women's rights organisations and some international humanitarian organisations noted that in many instances, program design was often where unequal power dynamics emerged, including minimal to no input on project design, which women's rights organisations then felt meant that the projects that were being implemented were not able to meet the needs of those that they were working with. There's also good to strong evidence that donors and partners helped to build the capacity of women's rights organisations to effectively and efficiently respond. So a diverse range of stakeholders reflected that conversations between women's rights organisations and their donor partners occurred quickly after the pandemic hit. And this early responsiveness really helped facilitate appropriate capacity support. So conversations covered operational barriers and opportunities COVID-19 posed, how to overcome or leverage these, what resources were needed, and what form of engagement was needed with government agencies as well. And although the overall picture in relation to capacity support was positive, again, some women's rights organisations felt they had not received a lot of support from their partners, really aside from the financial support. And there were three key areas. This was technical support, leadership support, and organisational development. That were areas in which organisations felt their partners could have provided that additional input. It's also important to note that these were challenges that were faced pre-pandemic and were exacerbated during the pandemic. And then in terms of funding, there's good evidence that women's rights organisations have sufficient financial support that enables them to respond effectively and efficiently to the impacts of COVID-19. Notably, for 72% of women's rights organisations surveyed, funding increased or stayed the same, and most interviewees accessed additional funding or were able to reallocate available funding for COVID-19 response activities. And again, those early conversations that were had with partners, as mentioned before, really helped facilitate some of those reallocation of funding. But again, while many women's rights organisations reported that the COVID-19 pandemic did not reduce their overall funding, there were findings that they would have liked greater engagement in and control over funding decision making and greater flexibility in the conditions attached to the funding, recognising that during a time of COVID-19, it is not business as usual. Just to the next slide, thanks. Wonderful. So really, what does this mean? So there is emerging evidence that women's rights organisations are able to contribute to leadership and decision making on COVID-19 responses at the community and LGU level, and that they played a really strong operational role in COVID-19 responses, leading activity implementation and service provision in the community and at a grassroots level. Yet the significant involvement of women's rights organisations and women in local and operational contexts was not reflected in the representation in national and strategic forums. And as is highlighted in the report, support is not consistently provided to women's rights organisations to engage in, influence and contribute to decision-making and leadership at the national level. And consequently, women's rights organisations' leadership in the COVID-19 response remains very localised and community-based. And at these levels, as I've mentioned, they do play a very strong role in the implementation of projects and service provisions. Just the next slide, thanks. So what does this mean? So really what we've found in a summary is that there is distinct and encouraging evidence that women's rights organisations are participating safely, collectively influencing and experiencing equitable partnerships in the COVID-19 response. However, this has really happened at the local level and has not been consistent either. That they play an incredibly influential role in community responses where women acted as primary responders, as Maya provided a couple of examples, and were able to direct the focus of activities. Despite this strong contribution, women's rights organisations had relatively little impact on the overall direction of the response. women's rights organisations reported that the appropriate organisations were not receiving funding and the national response was not responsive to gender-specific needs. So that's really a summary of the report. And what we're really interested in is what change needs to happen and what that looks like. So I'm going to hand over to Maya to finalise the presentation.
Okay, thank you. Next slide. So this is actually the last slide, but I think this is the most important part also of the presentation. After hearing the 4 domains, which we look into, and looking at the women's rights organization experience, but also to remind everyone that this is just a snapshot. It's not a comprehensive assessment, but we hope that this research can be an impetus to create somehow change. So first, we hope that this baseline can act as a catalyst for change among humanitarian actors, including government, national and international NGOs, UN agencies, private sector, etc. We also hope that this should prompt organizations and coordination fora to set targets and track change to better include, support, and elevate the role of women's rights organizations in the COVID-19 and broader humanitarian responses through 1, providing spaces for collective action, decision-making in goal setting and implementation, funding and technical support, and ensuring participation of women's rights organizations in every step of the way of project cycle or pandemic response. After this and hearing your thoughts about the research. Thank you.
Thank you so much, Maya and Pip. Well done. Thank you for sharing with us the findings of the research. We'll give you a break first before we probably go on the open forum. But now I would like to invite especially some of the research participants whom we have invited to share their thoughts on some points of the research. We are joined by Amy Santos from the United Nations Population Fund, or UNFPA, Darrell Liesa from Pambansang Koalisyon ng Kababaihan sa Kanayunan, or PKKK, Aya Tiongco from Women with Disability Taking Action on Reproductive and Sexual Health, or We Dare, Maros Ramos from Galang Philippines, and Bans Alcacir from Young Feminist Collective. So I'll be now giving the first set of the first question. This is directed at supposedly Amy, though she's not around. Probably it will be Daryl who would be able to give her thoughts on this. How can donors and international partners further support women's rights organizations so that they may safely and meaningfully access national level fora or coordination?
Hi, good morning, everyone. And thank you again, Maya and Pip, for the presentation of the study of the research. Good thing that Amy is not yet here, and I have a long list for the question. Thank you. Thank you for that wonderful question. Yes. To start with, for our experience as a rural women coalition, of course, our strength lies with the membership who are in the rural areas, in the grassroots communities. So for us, there's no new formula. Giving support to their local activities as they respond to local situation should be the primary areas of support by donors. I understand that many of the interventions are COVID-19 response related, as far as getting the community protected, hence the health-related protective measures such as dignity kits, PPEs. Truly, these are very well appreciated by our communities, especially if these are gender responsive. But equally important, though, is information. Imagine the abundance of fake news about vaccines, for instance. No? How I wish there would be more vaccines than the fake news, but still information is not yet getting to our communities, and this would also affect their participation in discussions in policy discourses. In terms of supporting local initiatives of grassroots organizations, we should be able to appreciate that the various issues are COVID-19 related to, um, but many of these are structural issues that may have been worsened by the COVID-19 pandemic. And for all we know, these are creating hidden pandemics waiting to burst. Even after we have survived this pandemic, then we will be surprised. There are new pandemics coming in, and these are very much affecting the women. So let's take GBV, for example. It was mentioned in the research, no? And how this have been worsened in the lockdown setting. So what we need to support are the women's initiatives to address GBVs. In our experience, we are organizing the GBV watch groups, but we also add the sexual and reproductive health. So it's GBV and SRH watch groups, and we have seen how easy it is to set aside important services for women related to sexual and reproductive health in favor or due to COVID-19 priorities. So if and when we have organized the GBV and SRH watch groups on the ground, and we can have models, and then we can present this in national discussions, that this should also be the policies or the programs that need to be supported and reflected in the national budget, no less. Another example of a local initiative are our women's response to health through food self-sufficiency. We recognize women's participation in local food security planning. This has been, I think this was also part of the findings, no, that our women are very much present in local development plannings and local food security plannings in the context of COVID-19. But all this can be canceled out because at the national policies, the priority is food importation. So how can they be supported in local activities of food production when food importation will be prioritized anyway? So it's the same with community seed banking. No, we do models of community seed banking, but at the same time, the promotion is for hybrid seeds. So again, all these are happening within the COVID-19 setting, but this should also be discussed. But because some of the local development councils or processes in development planning have been stalled also, not because of local restrictions, the women cannot participate in the development councils. But we feel that if we continue with our initiatives and we find good models, and we can have an advocacy that is evidence-based, and this we can sell or we can already promote at the national level as our basis. So we go back again to supporting local initiatives, and this can be the basis for our participation at the national level. So in the end, it's important really to have critical connections to connect the local to the national. And at the national level, we should have genuine representation. No, Amy is not here, but I learned from her the word is critical connection. But the critical connection needs to be facilitated by networking with a purpose. I learned that from multi-marketing strategies. Okay, so it's like I cannot find a way of how I can further illustrate this networking on a purpose, because I feel that today more than ever we should be supporting networks, alliances, coalitions that can help represent the issues from the ground. This is really very fresh. Yesterday, I attended a public consultation on a liquefied natural gas here in Batangas. So we were there. I was representing PKKK and our Batangas Provincial Coalition, and we were one with the climate justice groups asking that consultation should not pursue because it has jurisdictional issues. It was not publicly announced, and the women in the community were not consulted. So of course we were questioning the process. But what happened? The hearing officer continued with the public consultation and literally muted us. No, so that's the downside of the online platform. They can mute you literally. No, so and even the chat was disabled. So we were not able to continue barraging the hearing officer of our concern. But then again, this is a classic example of how public consultations can be railroaded. And these are the things that will happen in a COVID-19 setting. So I feel that we can only challenge these big forces, these corporations, especially the corporations, if we present ourselves as strongly connected, even if we are in our homes, like now I'm in my home, but then we can still connect, no? We can still connect with other groups who are pursuing similar issues. So I just want to need to emphasize that as we rise above COVID, it's not just the COVID-19, but how other forces are capitalizing the COVID-19 to their favor. So I'm talking about the corporations and all, and even other patriarchal structures that really hold down the rights of women. So I think this is for now. I just wanted to emphasize that we do not need to create a new formula. We just need to support the local women's initiatives and their continuing, their pursuit to realize their agenda, even we have this setting, this COVID pandemic. Thank you.
Maraming salamat, Ayel. I forgot to mention that Joey Cortina of Care Philippines will also be answering the same question. How can donors and international partners further support women's rights organizations so that they may safely and meaningfully access national level fora or coordination?
Hi, good morning. Thank you for including Care Philippines in this conversation. So, yes, Daryl really shared a very thorough account of her experience. And there's not much that I can add, but I think what I can add is from Care Philippines' unique experience as being a conduit of resources. So both as someone that, both as an organization that receives this support and also as an organization that funnels this support to women's rights organizations. So in particular, when it comes to COVID-19 response, one practice, I'd say Care Philippines is very fortunate because of our donors' flexibility in realigning funds, but and this facilitated the promptness of COVID-19 response, and also it made way for women's rights organizations to be more active in this delivering this response. So yes, the emergency fund of care is can always be utilized for emergency responses. So the COVID-19, the funds for COVID-19 responses, it came from realigned funds from existing projects. And the funders were really agile, very quick in making decisions, and they did not let bureaucratic administrative processes, which could include, changes in contracts, among others. And these processes, these bureaucratic processes, tend to limit the flexibility in these decisions to reallocate funds. So among the funders, one of the first that agreed to a budget realignment was a European funding agency. And in fact, out of the 5 projects under that agency, 4 allowed budget realignment. So this is what allowed for projects to easily provide funds for COVID-19 responses, which really involved the women on the ground. So it would have been really challenging, more difficult for CARE to respond to COVID if the funders were not that creative and flexible and agile. So that's what I can share. Thank you.
Maraming salamat, Joey. We hope, no, as we say in the Philippines, sana all, no, could be agile and
Yes.
quick in responding to the needs of women's rights organizations. Let's now go on to the second question, and this is directed at Ayat Yongko. With the pandemic looking like it will drag on longer and natural disasters or conflict are affecting our country, how can partners create opportunities for women's rights organizations to have increased engagements on the national level? I think some of portions of that have already been also touched on by Daryl a while ago, but we also want to hear from you, Aya.
Yes, good morning. I am a representative from We Dare or W Dare, Women with Disabilities Taking Action on and Human Rights. We are not only advocating for our reproductive health rights, but also for our human rights as person with disabilities. We are a group of women with with different disabilities, person with visual impairment, with mobility impairment, hard of hearing, deaf. We are included in our group. It is very important for us, a person with disabilities, to be understood by those people who are able or who do not have any disability. So it would be very important for 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 different organizations, other stakeholders to conduct disability awareness and sensitivity training. We have to start with the basics. We have to start um, sensitizing the families of persons with disabilities and even the person with disabilities themselves, because we are very aware that some persons with disabilities do not even know some of them, especially from the provinces, they do not know their capacities, their capabilities, since they were babied, being taking care of their families, since their families believe that they cannot do any reproductive things because they have their disability. But let us we want to reiterate that we only have disability because of the barriers around us. So to 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 to, to be called as person with impairment, not with disability. And many if ever you will ask a person without disability, which of the disabilities you do not want to have, they always say that visual disability. Yes. So in times of pandemic, we are using different platforms from the computer or the internet. Probably will think how the blind people or person with visual impairment cope with this. Some of us, or most of us, are starting to uh, to attend computer courses to cope with the pandemic, or to be able to attend different seminars, and to be aware of the different to be able to attend different webinars that tackles about uh, conduct also conduct or the laws and policies are also included in the webinars. What uh, what is our clamor, or why do we want to be noticed, or we do not want to be invisible by the sight of many people? Because we want a person with a disability to look at us as person with this THIS disability, or THESE. Just we want to take action program for programs or whatever platforms you will be using, we are very willing or we are empowered to be included in the plans and programs of whether NGOs or the government. Thank you.
Salamat, Aya. It's very important that technology will be more equitable, especially for people with disabilities, especially during the pandemic. And we've seen how this pandemic has exacerbated this kind of gap or divide, between the people who are able and people with disabilities. And this is more pronounced among women. Thank you, Aya, for that, for reminding us of that gap. So the next set would be reactions from Maros, and I also would like to acknowledge Sabrina Gakad of Lunas Collective, and again Aya, to answer this question. What do organizations see as the barriers to providing adequate inputs to COVID-19 response plans and programs? So probably I'll begin with Maros for her thoughts on this matter.
Hi, good morning, good afternoon, or wherever you are in the world. Okay. So the question is for the wonderful question that was assigned to me, to us actually, is what are the barriers? Actually, the research itself surface or highlighted already existing barriers even before COVID happened to all of us. So the research itself highlighted such barriers. One, I'll just mention some. So one is the WROs, or women rights organizations and women-led organizations, are not able to participate in all stages of planning and implementation of programs. So from planning to designing to the implementation itself of the programs, whether it's in response to COVID or post-COVID. So we're women organizations, women-led organizations, and women rights organizations are not really in that level at right now. And then in terms of planning and implementation of the programs itself, there's a lack of intersectionality perspective. The needs and the concerns of the different facets of an individual or a collective of women are not considered, like persons of diverse soji, economy and gender. Example are poor LBT women in the communities, the needs and the concerns of such. In our experience in Galang, during the start or at the onset of the pandemic, there are the identification of humanitarian aids beneficiaries. LBT women were not considered as beneficiaries, since same-sex couples or and families are not considered as legal families or households. So the definition of our government is not inclusive of LBT or same-sex couples and families. And as mentioned earlier by Daryl and I already, the inaccessibility or limited internet or technology. So we are all very much aware that the fake news is everywhere. So rather than there's limited actual vaccines in the Philippines. So people who have limited access to internet have also limited access or awareness on the realities, on the true picture or what's happening in relation to this pandemic. And then people who are not able to access online platforms and discussions such as this. And also yung as mentioned by Aya, also yung the PWDs who are not able to access or are not included when we do these kinds of discussions also. And then the limited or lack of gender lens of government and even international organizations, which results in a not so gender responsive and not so gender inclusive programs. The gender issues are not seen as priorities in these responses, in these programs also. So pre-pandemic, there are LBT women or LGBT individuals or persons of diverse sources who experience discrimination and violence from their families or even their intimate partners. And these GBVs are exacerbated because of us being locked down for more than a year, 300 plus days already. Also, the lack of accessibility to SRHR needs of LBT women, like the hormones and the even the ARTs for PLHIVs. And the lack or limited LGBT-friendly mental health facilities and services also. Those are the barriers, especially during now that we're all locked down. We're all, sorry for the term, jailed in our homes. Another barrier is, I think although us women rights organizations, women-led organizations, human rights organizations, we are more focused before pandemic, before COVID happened to all of us. We're almost focused on yes, providing, empowering the women in the communities, the people in the communities. But we are not all equipped on how to handle or manage this kind of disaster, this kind of outbreak. We are not really equipped on how to manage and reduce the impacts of this kind of disaster that we are facing now. And also, given that our government is not even providing us what, I don't know, what form of assistance for us to be equipped also to be able to translate it on the ground, on the grassroots. As mentioned in the research itself, women rights organizations are more visible and can participate more in the local levels. So how do we translate such kind of assistance? How do we provide assistance if we ourselves are not capacitated in doing such? So I guess that's it. Thank you.
Maraming salamat, Maros, for pointing out several of the barriers that are already existing pre-pandemic and have been exacerbated by this pandemic, especially for women of different SOGI. I'll now call on Sabrina for her thoughts on the same question.
Thank you. I'm just going to kind of zoom out naman. And Maras had already given very specific issues that have to be raised. So I wanted to contribute in such a way that we are looking at the bigger picture, which our officials fail to do. So the first thing I would say is, it's not so much the barriers that's the problem, it's the actual blinders that people in power have. So they appear to be blind to the sexuality needs of ordinary citizens that relate to mental, physical, psychosocial, and emotional well-being that is all affected by the pandemic. And so the blinders came when most of the centralized responses to the pandemic focused on law and order. And law and order as an issue devoid of emotions and feelings and fear and joy. So there was not that recognition at the onset. Tapos second, just not having the right gender lens, as has already been said so many times, the intersectional lens, a lot of the officials still don't have it. And that prevents officials first from recognizing that they don't know everything, that their relative power and their relative privilege cannot accommodate the needs of the ordinary people who are facing COVID in a very different, with a very different experience. So I wanted to flesh that out. And I wanted to tie that to how if, kasi at some point, the responses to the pandemic and the social welfare of people was suddenly decentralized to local government units. And this is where the study makes mention of brilliant feminist leaders that had the lens of gender, that had the lens of intersectionality, to begin to implement programs that responded to the various needs of people with disabilities, people of diverse sexuality, the needs for reproductive health and gender-based violence support. So I think I wanted to highlight that contrast, that if you had the proper lens, if you didn't have the blinders, then we might have a better response. And then finally, I wanted to also emphasize how empathy was lacking in the response. Empathy as a public policy tool is crucial during the pandemic. Pandemic responses, it's a healthcare issue in the sense that it's a virus that you don't want people to get sick. And by a healthcare issue, we already have care in the essence of it. So parang care requires empathy. And then if empathy was a public policy response, then it would be easier to ask people what they needed. Because I don't think anyone expects government to know everything, but precisely why women's rights organizations exist, precisely why all these development organizations and humanitarian sectors, why we all exist is because we recognize one centralized power can't accommodate all of our needs. So the idea with empathy was to recognize that we all experience the pandemic in different ways, and it's more efficient actually to begin to seek out the people, the organizations that did not have that same level of power and privilege, and then try to find out what their needs are. And this was not in any form an initiative from a centralized response to COVID. And this was why it was so important to have women's organizations at the grassroots level making ends meet. Because every time naman women and the humanitarian sector and women-led and people-led organizations have been making development work to our favor, given all the odds stacked against us. So I think we could have capitalized on this fire, but we did not have the right lenses, or we didn't have the right leaders with the right lenses.
Salamat, Sabrina. I'll pick up on what you said about, governance with empathy, and I'll keep that in mind as probably a next thought, a food for thought for governance programs, and that would include also women's WROs to also see that kind of lens also in doing their work. Aya, would you like to add some more to what has been shared by Maros and Sabrina?
About barriers. Okay. First, one of the barriers in among persons with disabilities is the unavailable data. How many are the persons with disabilities in the community? Where are they located? We have data, but the survey was held last 2010. So it was a decade ago, more than a decade ago. So we need an updated data on the number of persons with disabilities in the community. And then also, as the first reactors have said, the internet connection was always was always weak, and most of the families of persons with disabilities belong to not well-off families or well-off groups. So most of the persons with disabilities who want to attend seminars and webinars depend on the data connection. So they need some funds for that, because they cannot afford to pay the monthly bill of the internet connection, and if ever they have data connection, still is this the connection is weak. And I have listened to the paper about the barriers on communicating with and conducting webinars among persons with disabilities. Is they have mentioned unavailability of sign language interpreters. I just want to add the unavailability of closed captioner for hard of hearing, and the unavailability of reading materials. Reading materials of coming from the hosts of the webinars are not accessible to us, to person with visual impairment. They are in PDF form, so it won't be accessible for our screen reader. And then another another barrier was the violence against women, or the violence against women that I know. I mean, aside from the violence against women during the pandemic among women with disabilities, most of the person with visual impairment are working in massage parlors, so it was stopped. So some of the person with disabilities, most especially person with visual impairment, went to the streets and begged for some money in order for their family to be fed, and their children to be fed. So it was so saddening that it is happening, or it happened among us, because person with disabilities, when when they were asked by during our peer monitoring interview, they were asked, what do you want if you are given the chance to talk to the LGU or the government? What are you going to tell them? They did not ask for money or financial support, or any dole out support. Their answer was livelihood, because during pandemic you can still conduct livelihood, and also they still can attend, especially even the person with visual impairment. It can be available for person with visual impairment. So those are the barriers that we person with disabilities are facing during this pandemic.
Maraming salamat, Aya. We are running out of time, so I'll call on Vance specifically to answer what shifts can women's rights organizations do to adapt to low or competing resources for COVID-19 response? And in turn, what shifts can donors do to sustain support for women's human rights organizations in the midst of low or competing resources for COVID-19 response? Vance?
Thank you, Marcel. So let me preface this by emphasizing that this shouldn't be the norm, but at Young Fem, we've managed to get by because we were able to tap donations from individuals online, and sometimes we pitch in our own resources. At because lagi na lang, nahahanapan ng paraan kasi kailangan. But again, I emphasize the burden shouldn't be on women's rights organizations. But the situation is what it is, no? As for what could help given where we are, if your organization specializes in an issue, develop your work on that. I always remind my friends and myself na hindi natin pasan ang daigdig. We can't spread ourselves too thin. We take the leads on those we have access to, expertise on, and feel passionate about. But for other advocacies, we let others who are more familiar with it take the lead, and then we provide support in ways that we can. One of our takeaways then, and I've heard this throughout our discussion kanina, during the pandemic, ay yung kahalagahan ng internet equity, because social media presence is unfortunately crucial in every advocacy during the pandemic in terms of inviting more volunteers, spreading awareness, and reaching out to partners and donors. I also have to emphasize, though, that I don't like this framing in a sense that it's a competition between women's rights organizations. But I guess also, in a sense, it is because there are limited resources that will only go to a limited number of organizations. So I guess the better answer here is to link up and collaborate with other organizations, pool resources and networks where we can. And we may be a loose collective with limited resources, but because of our network and partnerships with old-time feminist organizations and new, young feminist organizations, we were able to do so much more in the past year. But what I really want to focus in this answer, focus this answer on though, is on the part of the donors. I understand the need for transparency and accountability, but I think I can speak for many here who have had to deal with so many unnecessary requirements, which may be discouraging, if not disqualifying, for small women's rights organizations who are doing very important work in the grassroots. First, I am sure, and I'm sure nabanggit to ni Joey kanina, a lot of organizations are doing this already. But the one thing that we can do for the donors is to realign and reallocate the funds. A lot of indirect costs are no longer applicable during the pandemic, and we have to funnel this budget to support and fund women's organizations. Second is that pre-pandemic budget restrictions and other reporting requirements are no longer applicable and need to be revised to accommodate the shift on project implementation. I'm trying to be brutally honest here, especially for projects that have been approved prior to the pandemic. I think it all boils down to maximum compassion towards all stakeholders. I think ito yung sinasabi ni Ina na empathy din. We're trying to do our job while trying to survive a global pandemic, and that is not easy. Lastly, I don't know if you all think of this too, but let's cut the middle person or the middleman. I guess we can all call it middleman because the connotation is negative anyway. I've encountered this a few times, and I've seen big firms that are not even based in the Philippines taking on projects and funding from donors only to subcontract it to grassroots organizations here. By going directly to these organizations, we actually empower them more. And the project actually gets better and everybody wins. I think we can all admit that sometimes donors reach the usual suspects in any given country. But grassroots organizations doing good, impactful work don't get much support because they're not well versed in admin and finance, or because they don't write in English well. So let's reward actual good work more than admin and finance expertise. Yun lamang po.
Salamat, Vance. Parang tagos sa puso yung yung comments. Since again we're running out of time, I'll go straight to the last question, and I would engage all those who, all of the reactors, whoever will just allow for like 1 or 2 reactors to answer this question. In a shrinking space for democratic participation in the Philippines, how can organizations, especially those representing marginalized or intersectionalities of women, creatively yet effectively exercise its leadership and meaningful participation in COVID-19 response? So whoever wants to answer that question. But parang wala. Nag-shrink na ba talaga? De? Sige. Whoever wants to answer that question.
Can you repeat the question?
I just want to share point of view from the local government unit. I'm Mayor Vivian Alvarez of Oras Eastern Samar. I was listening to all of your inputs a while ago, and I just have some comments, and I will just answer the last question. I commented in our chat box that all boils down to good governance. Even during the time of pandemic, we in the government units should ensure still the balance in the delivery of the services. Hindi po COVID lang ang problema ng Pilipinas. Hindi rin lang po yung PWDs, hindi lang yung food on the table, hindi lang yung senior citizen, but of course we have to make sure that we deliver services to all areas of concern. During the time of pandemic, nakapagbigay pa rin po kami ng assistance for the seniors, even po ng assistive devices for our PWDs. Kasi during that time, very low na yung feeling ng mga tao at pababayaan mo pa yung mga regular na services na dapat dinideliver natin sa kanila, the more, na mas lalo pong babagsak yung pag-asa ng bawat tao doon sa ating mga communities. So I would siguro share na lang sa inyo na dapat talaga on the issue of accountability, everyone's accountable in our fight against COVID-19. But we, the officials who were trusted by the people to deliver the services to them should be on the front line. Hindi po pwede na nagtatago tayo at iiwasan natin yung ibang mga responsibilidad natin kahit po may pandemic. Now, in terms po doon sa question natin ngayon kung paano ba, actually during the forum sa DOST, I shared this. In the past, we were not familiar with God. Nagsimula tayong mga nung gender and development pero nagawa natin. Dumating yung programs natin, Typhoon, Yolanda, na nag-focus tayo sa disaster preparedness. We shifted disaster preparedness to community-based disaster management. Now, in the future, if we were talking about the future here and how we were going to engage everyone, since accountability is not only on the level of the officials, but it boils down to the communities. Siguro kahit papaano I can share here in Oras, we tried to shift accountability to the community level so that our responses on COVID-19 should be community-based. Hindi po kaya ni doktor lang, hindi kaya ni nurse lang, hindi kaya ng mga organizations lang. And luckily, medyo swerte ako sa aking pagtingin dahil ang aking civil society network is very active here in Oras. They took part in our fight against COVID-19 in terms of advocacy, in terms of direct services, in terms of the policy making which is applicable at all levels at a given time. Sumasama po ang civil society and it made our fight against COVID-19 easier. So I would want to suggest dapat we also have to shift. Hindi pang national level itong problema ito. Community-based dapat. So shifting from a disaster risk management on a national level, let us shift this back to the community level. It is here where we can join our people in the community to help us and to fight COVID-19 with us. So importante po ito. Thank you.
Salamat po, Mayor, for your sharing. We hope that more local governments will be able to shift the way you're shifting your thinking also of how to respond to the COVID-19 pandemic. Lastly, I'll call on Ina to give her thoughts also on the last question.
Yes, I wanted to highlight yung kind of leadership that sees the power in every individual that exists and experiences COVID-19, the socio-economic pressures of mobility restrictions, and all the other intersectional problems that existed before COVID-19. So parang COVID-19 just made everything worse. But these problems were existing way before, and people have been taking steps on their own and through women's rights organizations and other formations to respond to these problems in a way that is appropriate to each of their needs, diba? So I wanted to highlight that there is this untapped resource na endless and super abundant. Parang if funding were scarce, and we're hoping it's not, right? But if we wanted to move beyond the capitalist framework of, well, funding is scarce, therefore these groups lang will get funding and all the rest of you will have to wing it. Everyone's been winging it from the very start. So what if we just start looking at the resource of individual power and then transforming that to solidarity? And solidarity, I think, is super important because that's different from charity, where people just give their excesses, diba? But solidarity recognizes that we, each of us, have shared experiences and have shared needs, and we can actually respond towards solving these shared needs together. So parang that's like capitalizing on democracy, maximizing solidarity networks, including as in exchange of services for each other, orgs exchanging services for other organizations. Where can we make more partnerships? And then funding can support that in such a way na ano yung pinaka high impact parang nodes of these intersections that can benefit from a lot of funding that will then increase the impact to more people outside on the fringes. Parang ganon. I wanted to say that kasi there is huge volunteer power that exists. I think Young Feminist Collective knows that. Luna's Collective was built because of volunteers. And these volunteers are not there just because for a one-time thing. They're here for the long haul. So people have the energy for the long haul, but they have to be channeled towards a community project. So that's what I wanted to say. Thank you.
Salamat, Ina. Palakpakan naman natin yung lahat ng ating mga reactors. Gamitin naman natin yung reaction button natin just to acknowledge also their thoughts and their experiences, you know, being also the first responders also to this pandemic, for also being part of the empathy, and solidarity that we are all, you know, needing at this time. Kulang tayo sa oras, but I'll run through some of the questions that have been raised here on the chat box. There are quite a number. And anybody from Maya, Pip, and the reactors could probably also give their thoughts. Just unmute yourself later. So question from Rodora Albano of CMA. Looking forward, given the election season that has started, how can development or donor partners support local women organizations and pushing their electoral agenda amidst the COVID pandemic? Are there open windows or doors for this? I suppose this question should be answered by the donor, the donor community. How could we support the electoral agenda of women's organizations? Quiet. Still concentrated.
Marcel, pwede ba ako?
Sige, Chang.
Sige, magandang umaga po sa lahat. Siguro very briefly lang on electoral, UN Women would be very interested to also convene or provide a platform to discuss yung electoral meaningful participation and leadership of women, especially in promoting the women's agenda. Not only in terms of the pandemic response, but in the governance as a whole. So at least for the UN Women Philippine Program Office or presence, we will welcome the initiative to jointly organize consultations, and we're also open to conversations on what support we can provide, be that financial resources, technical or otherwise. So that is just to register our interest in this as well.
So ayan, UN Women has the window and probably the door for women's organizations to be part of agenda building. And we really hope that this would also push through, because a lot of organizations are looking at UN Women as the potent channel that could navigate the government as well as the WROs, you know, on this matter. Thank you, Chang, for that. These are several questions from UN Women, but again, I'll raise this on the floor. For collective influencing and advocacy efforts, are there any specific examples or best practices that you know that enabled local and community initiatives to hurdle barriers and be recognized and considered in national law reform or policy agenda? Hope some of these experiences can be shared. Hopefully we can collectively build upon this or replicate. I think Patty, you could also touch base with Mayor Vivienne, because she was already able to cite some of the things that they have done, and probably you could dig deeper also with that. But is there anybody here from the local government or probably some of the community initiatives that you would want to share? Probably you could share also to Patty. And then this question is, from Chang. Are there networks or groups or WROs who specifically sought out engagement with interagency bodies, national or local, with mandates on COVID-19 pandemic or emergency response? So meron ba from us, from the participants that sought out that, like engage with the IATF or like say the DRR?
Marcel, yeah, Daryl here.
Sige, Ayel.
Well, in our case, during the first part of the lockdown last year, we engaged through a network of agriculture and food security network. We engaged the IATF, so primarily forwarding our issues as farmers, fishers, rural folk. So again, babalik pa rin tayo dun sa we should be part of a bigger force para they can also give attention to us. No?
How
So
did it go, Ayel? Na-forward ba yung mga in-input ninyo?
Yeah,
Kasi
yes,
ngayon,
because
kukulang tayo sa pagkain eh.
medyo hindi. But at the start, we really pushed for mobility of the food producers. So that's one thing. And to ensure that they're given attention. But then there's the blinders, yung sabi kanina ni there's a different treatment or different situation for women farmers and men farmers, of course, because at that time, mobility, while we argued for that, that was granted for men farmers. No, so because they have the quarantine passes and they have the means to they have access to transportation, which is not the case for the women farmers. And also at that time, we were also arguing within the network who engaged with the IATF that we should also address issues of GBV. So that's where the intersectionality and the gender lens comes in. But then again, may struggle pa rin doon kasi we have to sensitize the network itself who is who is reaching out to the IATF. So may process talaga.
Ganun talaga, no? Salamat, Ayel. Ang dami, no? Ang dami nating tanong. We have so much comments and insights, and I think it's just so that the time is really so short, but don't fret because this series is just the first of it. There are still 3 more others that will be coming your well. And we hope that you would continue being part of this discussion series. Probably I could ask the secretariat to, give fillers already on the succeeding discussion series so that we could already get some of these questions and our reactors or presenters could already take all these questions in so that we have a more pointed discussion and, some of the questions can already be addressed in the presentation. So maraming salamat kay Ayel, kay Aya, Maros, Vance, Joey, and Sabrina, Ina for being part of sharing your insights. And so, just so you know that while we are discussing here, someone is intently listening to us and doodling a creative synthesis of our discussions. So at this point, we now call on Desiree Lanos D of Tofu Creatives for the creative synthesis of our discussion today.
Hello, everyone. Thank you for such a rich discussion. So I'll just walk you through this graphic recording of today's talk. So we started with Gael, giving the context that it's 1 year later. How do we support each other? How do we move forward? And this strong message of listening, sharing, engaging, which most people reiterated in the whole session. And then the framework and the tools. Essentially, there was moderate evidence for safe and meaningful participation and collecting, influencing, and advocacy. And there was good to strong evidence for partnership capacity and funding. And there was limited evidence for transformative leadership. And then for barriers to access, these were mentioned: no sign language, connectivity, lack of presence in national decision making. But women continued to play a strong role in operations and grassroots and community based initiatives. And how they ended with how can this create change? This baseline research is a starting point and a catalyst for change for humanitarian actors. And it's an invitation for organizations to set targets and track changes from this baseline. And as for the very rich discussion, there was mention on there is no new formula, and we have to continue our strength in local initiatives and how it's really important to foster critical connections from national programs to local initiatives, and how flexible funding, sana all, and this strong quotation on they literally muted us in a public consultation. Uh, then the conversation on barriers have existed and now are being exacerbated. This includes the equitability of technology. Homes can feel like jail. LGBT sector not included as beneficiaries. There's a lack of gender lens in leadership. There's a need to update data. There's a lack of empathy and response. And finally, there were these ending messages on um, how we must link up and collaborate where and when we can. So we started with how do we listen, engage, and share. And this was answered with forming critical connections, collaboration, empathy, and maximum compassion. So thank you, everyone. It was a pleasure drawing the big picture with all of you.
Salamat, Des. As always, you make me giddy with all these doodles that you've made, and it's a very creative way of presenting all that has been discussed. Thank you so much, and we really enjoyed your doodles, and this captured a lot of what we have been thinking and discussing throughout the day. Before I call on our closing remarks, I would like to acknowledge and probably ask PCW Executive Director Attorney Christine Yuson Chavez if she's around and if she has something to say also very quickly. Lady Christine.
Hello. Sorry, I need to turn off my video because of bandwidth. But anyway, I would just like to commend the organizers of this event for gathering all of us together to have meaningful conversations this morning because it is. Hello?
Yes, ED. Okay pa po kayo. Apa.
Hello? Hi. Hello?
Yes, we can hear you po. Lady Christine. Lady Christine. Oh, we lost her in the conversation. Sige. Probably we'll catch up with ED later. So may I now call on the UN Women Regional Humanitarian and DRR Advisor, Maria Holzberg, for her closing remarks.
Thank you so much. Sincere appreciation to all speakers and to the humanitarian advisory group for this brilliant webinar. We're really happy that this series is starting and that we're starting specifically on talking about women's leadership. You are all well aware of what this process looks like, and we wanted to really focus on enhancing the leadership aspect, the capacities aspect of women, and women's groups, and this is why we felt from the regional side, but also from country level side, that we wanted to showcase or discuss as a baseline what women's leadership looks like in a COVID response context. So that is a bit of background to why we wanted to partner with the Humanitarian Advisory Group, and we also wanted to do this baseline specifically in the Philippines, and we wanted to thank you profoundly to all speakers today, as well as all contributors and reactors, and for everyone who's contributed on the chat as well. I think for me, listening to this, it really shows me that we really need to do more. And I want to echo the point made by Barn in the Young Feminist Collective on that the partnership aspect of the different women-focused groups and civil society actors is absolutely critical. And this is something that we learned also from the UN side, that the partnership and working together is where we are able to advance these critical issues. I'm hearing that we need to do more. There is obviously not enough funding, and we're not having enough impact. We hear loud and clear that when we do have shared values, and maybe shared values based on feminist principles, there is a better impact in the programming that is being achieved. We hear and acknowledge the unequal dynamics between the different organizations, and we acknowledge that we play a role in that as well. I recognize, and we very, very much want to see this as a catalyst and use this baseline in other contexts. And actually, we're doing a similar study in Indonesia, and we want to apply this in other countries as well. But also, I would like to make it really reiterate the continued commitment for us to find the ways to support women's leadership and the leadership of women-focused organizations into COVID-19 response and recovery, but also in any type of humanitarian, peace building, disaster risk reduction effort, because we hear these voices are so absolutely critical. I want to also acknowledge, and I should have done that to begin with, obviously all the speakers, but just thanking also the Philippine Commission of Women for being present. And I'm sorry that the line did not work towards the end, but we really value this partnership that is established with both a government counterpart and civil society. I also wanted to thank Tofu Creatives for the beautiful graphic recording. And obviously we wanted to thank the government of Japan for supporting this dialogue series. And we will be conducting similar dialogue series also on a regional level through the regional humanitarian, gender and humanitarian action. So this is my thank you to all participants and to the organizers, and have a lovely rest of the day. Thank you very much.
Thank you, Maria. I think PCW ED Christine Chavez is back online, so we want to hear from her very quickly.
Hi, I'm so sorry I got disconnected. I have problems with bandwidth because two of my children are homeschooled, so I'm sharing bandwidth with them. Anyway, I'll just make this quick. I just want to thank UN Women again. UN Women has been a very active partner with PCW in so far as advancing our advocacy is concerned. I am glad to see and hear the views of all these wonderful women representing all these women organizations, and we hope that the challenges that were surfaced this morning will be addressed eventually. This is very timely because if we all know, our the gender global index shows that we have slid one notch, and this is highly because of a dip in women's political participation. So an avenue such as this one is it's a very good way for us to share how we can improve in that aspect. So thank you very much.
Salamat po, ED Christine, for your message. And as always, we look forward to greater partnerships meaningful partnerships with PCW, not just on humanitarian, but also in other issues as well. So as always, in any webinar in the Philippines, we would ask everybody to turn on their videos so that we could have a capture of the participants, and also to acknowledge also your presence. So we would ask everyone to turn on their videos, and the Secretariat will be having the screenshot of our photos. So yun. Again, so ready na po ba ang Secretariat at ang mga videos? Marami pong salamat sa pagdalo for this first. Remember, this is our first online discussion series. There will be a second one on May 4, same time, 9:30 to 11:30. And this time it will be on women with disabilities. So we hope that you could also participate in that next online discussion series, April 4. Yes,
Sorry, Marcel. May 4 is the first part of the Leaving No One Behind discussion. The Women in Disabilities discussion will actually be on May 11.
Sorry.
It's
Thank
okay.
you. So are we ready now for the screenshots?
Yes, Marcel. I'm taking the photo, by the way.
All right.
Okay.
Ako din, Dami. Sige.
Okay. Okay,
Oh,
first
sige.
page for now. Show us your wonderful smiles, everyone. Right. Okay, hold it. We have the next page. Okay, second page. Yes. Thank you. And finally, the third page. We have 3 pages. All right, it's done.
Maraming salamat, Kami. Also, if you could share in the chat box the link for the research that was made by HAG, because people are also asking about it. And there are questions whether the doodle of Des will also be part of the material that will be sent.
Definitely. Yes, for everyone who's here, of course, we'll be emailing you the presentation, the materials, and of course the doodle. It's for everyone to remember this discussion by, and we'll also keep you updated on the next discussions that will happen. And yes, Dr. Adith Afwang, thank you for coming. Yes, we will definitely share this video in our social media. And we actually hope to be able to incorporate captions as well, and as well as sign language interpretation when we share it, so that it could be widely shared to other people as well. And yeah, thank you again so much.
Maraming salamat po sa lahat. Dito po nagtatapos. Here ends our discussion series today, April 20. Thank you so much to the Humanitarian Advisory Group, Pip and Maya, to all our reactors, Ayel, Aya, Maros, Vance, Ina, Joey, for sharing their time with us. At sa lahat po sa inyo na nag-attend po dito ngayon, maraming salamat po. Stay safe po.
Thank you, everyone.